For the last 25 years, Canada has been swept up in a worldwide asthma epidemic. Today, asthma affects about 12% of children and 6% of adults in this country. Call it about 3 million of us altogether. The adult onset cases, an estimated 10 to 15%, are caused or aggravated by exposure to the many sensitizing agents or irritants that may be present on the job. That means, roughly, up to 200,000 Canadians have developed some form of work-related asthma. In Ontario, the number of occupational asthma claims has tripled over the last decade. It is also one of the most common diseases that go through the Workplace Safety and Insurance Board. Occupational asthma, or work-related asthma, is asthma that happens for the first time because of exposure to some kind of agent at the workplace. It is important to note that people who have asthma before may also have symptoms that get worse because of something at work. What exactly is asthma? Asthma is when your small airways narrow and make it hard to breathe. This means that the airways have become smaller but can return to normal either on their own or with the use of some medications. Some symptoms include cough, chest tightness, difficulty breathing, wheezing, and with occupational asthma, there also may be nasal irritation. A worker suffering from occupational asthma presents all the symptoms commonly associated with the other, more familiar forms of the disease. Certain dusts, vapors, fumes, or gases in some workplace environments can irritate and inflame workers' airways.
Asthma can present in two ways in response to workplace exposures. The first is the most common, and that is an allergic type of response, where over a period of time a worker becomes sensitive to the exposures and there's development of inflammation and irritation of the airways. The other type of response is one which occurs to a high concentration of a chemical. Symptoms occur immediately and symptoms can persist over a period of time.
The treatment of work-related asthma starts with control of workplace exposures that have caused or keep making asthma worse. Long-term medical treatment of occupational asthma may not be needed if the workplace exposures are controlled. Sometimes, occupational asthma does not go away, even after the exposures are removed. If this is the case, medical treatment is the same as that for any other asthma. Drugs that you breathe in, like puffers, are common treatment for asthma. There are different types of these drugs, including ones that decrease inflammation and ones for quick, sometimes emergency use. Occupational asthma is not confined to the chemical plant, the factory floor, or even the schoolroom. Farms can harbor many of the allergens and irritants long associated with asthma, including grains and fodder, mites and bacteria, molds and dusts, fertilizers and pesticides. But the biggest asthma threat on the farm is posed by livestock. More than 2/3 of agricultural asthma cases are triggered by exposure to the dander from swine and cattle, the feathers and feather tips from poultry, the endotoxins found in animal feces, or the ammonia in swine and poultry urine. The effects can be pretty dramatic, and most farmers don't have the luxury of booking off sick for a couple of days. Livestock need to be fed and cattle milked. Being laid up with an asthma attack for 48 hours during harvest time could be devastating to an agricultural operation. Education is a vital part of the prevention puzzle. There are steps that you can take to protect yourself. Wear NIOSH-approved, properly fit-tested dust respirator masks to protect against dust, bacteria, fungi, and insects. During cleaning of barns and stables, areas should be wetted down to avoid dust from becoming airborne. Ensure adequate ventilation in animal lodgings to prevent buildup of ammonia. Frequent removal of animal waste may prevent buildup of ammonia and reduce exposure to urine and fecal allergens. If you suspect that you have agricultural asthma, remove the occupational exposure to the substance that is causing the asthma. Seek medical attention and speak to an occupational health professional to learn more about occupational asthma. For more information, contact your local occupational health clinic for Ontario workers, or check out their website at www.ohcow.on.ca, or for Southwestern Ontario, call 1-800-565-3185.